The African healthcare system is on the brink of collapse. Chronic diseases are soaring, and tackling infectious diseases that could spread overseas is now becoming difficult as Western countries are cutting off the much-needed aid. Africa is fighting wars on multiple fronts. West Africa is grappling with a wave of coups since 2020. Central Africa and the Horn of Africa are plagued by armed conflicts in Sudan, Central African Republic, the Democratic Republic of Congo, Ethiopia, Somalia, etc. Civil conflicts in Sudan has pushed nearly half of its population to the brink of malnutrition. The World Health Organization projects a shortage of 6.1 million healthcare workers in the African region. In sub-Saharan Africa, non-communicable diseases, including stuff such as hypertension and diabetes and heart disease, have accounted for nearly 37% of the deaths in 2019, up from 24% in the year 2000. They're forecast to become the leading cause of death in the region by the year 2030. Now, according to Dr. Gitanji Gitahi, the group CEO of AMREF Health Africa, 50% of all admissions in a typical African hospital are non-communicable diseases, and yet 80% of the NCD care is out of pocket. The governments don't have the money to actually take care of NCDs. The US funding accounts for half of all development assistance to Africa, and Donald Trump had put a 90-day halt to all US aid soon after taking office. But if the US turns its back on Africa, then governments on the continent will find it hard to completely replace the lost funding. During the first cabinet meeting that was held by the American President Donald Trump, Elon Musk, who has been tasked by Donald Trump to cut off US government spending, has spoken of the pitfalls of this mandate.
Also, we will make mistakes. We won't be perfect. But when we make a mistake, we'll fix it very quickly. So, for example, with USAID, one of the things we accidentally canceled very briefly was Ebola, Ebola prevention. I think we all want Ebola prevention. So we restored the Ebola prevention immediately, and there was no interruption.
While the Ebola funding has been restored, the full impact of aid cuts for other health programs and emergencies needs to be assessed. Right now, however, it is leaving the healthcare in the African nations in a very fragile state. Our correspondent Calden Ongmu has sent us this report from Johannesburg. Listen in.
Africa faces a double burden of infectious and chronic diseases. WHO had once projected that over the next 10 years, the continent will experience the largest increase in death rates from cardiovascular disease, cancer, respiratory diseases, and diabetes. African health systems are weak, and national investments in healthcare training and service delivery continue to prioritize infections and parasitic diseases. There is a strong consensus that Africa faces significant challenges in chronic disease research, practice, and policy. Experts have said the healthcare system in the continent is generally characterized by significant underfunding, inadequate infrastructure, a shortage of skilled healthcare workers, and unequal access to quality care, with most Africans relying on underfunded public health facilities, while a small minority has access to better private healthcare options. This is Calden Ongmu from Johannesburg, South Africa for WION World is One.